Hi, I'm Chelsea from Vail Health, and today we are speaking with Dr. Kate Schuetze about peripheral vascular disease. Can you tell us a little bit about what the disease is and what are some common signs and symptoms for men and women?
Absolutely. Thanks so much for having me. So, peripheral vascular disease is a big term that encompasses a lot of different disease processes. The most common is peripheral artery disease, or PAD, and that's primarily what I treat. But there's also a large subset of patients that have venous disease. Some patients both have PAD and venous disease. We can see mixed pictures. And then less common, but also very significant, are a group of typically genetic or inherited vascular disease processes, and then acquired vasculitides as well. All of these can have overlapping signs and symptoms, specifically speaking to PAD, because as I mentioned, that's the most prevalent, but also underdiagnosed. The most common symptoms that we see are pain, essentially. So the classic teaching is somebody comes in and says, man, doc, I'm trying to go for my walk and I get about 100 yards or so and my calf cramps up and I have to stop and rest. And then it goes away pretty quick, and then I can walk again, but it kind of does that pretty reliably. So the medical term for that is called claudication, and that, I would say, is the classic symptom. That being said, as also we see with cardiac disease, a lot of patients have atypical symptoms. So a lot of patients have maybe, say, leg weakness or fatigue, sometimes numbness and tingling, although that can be difficult to tease out because there's a lot of neuropathy as well. Once it gets very severe, then we worry about things where people have wounds or ulcers that don't heal or take a very long time to heal. Sometimes there are findings that we can also see on physical exams, such as in men specifically, you tend to see this. They lose their hair on the lower legs. Sometimes there can be color changes. In really severe symptoms or cases, rather, people will complain of pain actually at rest, specifically at night. They'll say, my foot is waking me up at night and I have to hang it off the side of the bed. That's a sign that they're so reliant on gravity to help them with blood flow that when they prop it up, they don't have enough blood flow. So these are some of the signs and symptoms that we look for. But as I mentioned, there can be a lot of atypical signs and symptoms. So a lot of providers and a lot of people rely on risk factors for identifying, could this be something that's going on? Common risk factors, number 1, 2, and 3 is smoking. It's a huge risk factor. Diabetes is a risk factor, high cholesterol, high blood pressure, but also other things that we don't commonly think of. Family history. Sometimes this runs in families. And notably, there's a difference between men and women with respect to PAD versus coronary disease or heart disease. We think of heart disease as being more common in men, and that's not a risk factor for PAD. Men and women are affected equally in PAD, which is an important thing, I think, both as a patient and a provider to remember. So we look at these risk factors, but again, there's a lot of patients that don't necessarily fall into those risk factor categories, especially in a community like this. So I really encourage patients that, exercise regularly. And if you have symptoms that you're worried about that you think aren't normal, certainly that's a good time to talk to your doctor.
Wonderful. Thank you. If a patient were to come into the clinic, is this something that you could diagnose when seeing you in the appointment?
Absolutely. So one of the beauties of vascular disease, and PAD in particular, is that it's actually really easy to diagnose. In a clinic visit with me, when you combine the history, what you tell me, physical exam, feeling your pulses, and then using a super simple tool called a Doppler device, I can actually hear the pulses. And there's really good distinctions between what's normal blood flow, what's mildly abnormal, and what's severely abnormal. If I suspect that a patient might have peripheral artery disease or another type of vascular disease, then usually we can follow that up with non-invasive imaging to both solidify the diagnosis, but also guide our treatment strategies. It's also an important thing for people to know because while some treatments involve, procedures or stents or surgery, there's also a significant role and a huge benefit to treating patients with medications. You may not even have very severe symptoms, or maybe you don't have symptoms, but it's an important thing for a patient to know because there's a mortality benefit, meaning that if I treat you with medications for PAD, you're less likely to die, usually of heart attack, because there's a big overlap between coronary disease and vascular disease. But that's one thing that people don't often think of is it's important to know, even if you don't have symptoms, even if you don't need a procedure, there's medications that we can use to reduce your risk.
Well, thank you so much for joining us today and answering our questions.
Absolutely. Thank you.